What's going on, guys? My name's Josh Holzworth. I'm a physical therapist. Just opened up a new facility with Penn Ohio Rehabilitation here in Harmony, Zillionople area. First, wanted to thank the cycling community for filling out that survey that we posted earlier on this week. Thank you for the overwhelming feedback. Over 40 of you completed the survey. I had a little bit of time this morning to crunch some of those numbers, to put together a little video on some corrective exercises you might all benefit from. First question, how many hours a week do you guys cycle? Over 60% are cycling 5 to 10 hours a week, and then the overachievers are cycling, almost 40% of you are cycling greater than 10 hours a week. And I don't know if that's still going on right now with the winter months, and if it is, you're crazy, but kudos to you. But with that said, the number one answer for how many, over 50% of you, how many hours a week are you sitting at, hours a day are you sitting at work? Greater than 6 hours, over 50%. So doing some math, that means that about 50% of you are actually sitting 40 hours a week. So we wanted to put together a little video to show you some of these corrective exercises that might help benefit you, because when you're sitting, your hips are primarily in a flexed position, and when you're riding a bike, your hips are in a flexed position, as well as your lumbar spine. So again, here's just a couple of exercises. There's a lot more detail we can go into, and if you are having pain, dysfunction, discomfort, you're welcome to give me a call, 412-499-4524, and we can go into a little bit more detail, but at least these could get you going on some movements that might help you out. So I want to introduce my partner in crime here. This is Caleb Peters. He's going to be the movement guy here and demonstrate some of these exercises for you. So first one, Caleb, is going to be getting people out of that flex position. So we want to start putting that hip into a little bit more extension. And I'm going to have you show them a couch stretch. So on this particular exercise, you'll be able to roll up a towel, take a cushion off the couch, if your husband or wife lets you, and put your knee down right onto that pad, just so you're not smashing your patella joint. We're going to talk a little bit more about knee pain in the future, but let's not cause it with this corrective exercise. So some points of performance here, when he's in this position, he's in this half-kneeling position, we want his trunk and his hips and his torso to all be in a nice straight line. Okay, we don't want these hips to be muted or flexed or the back to be rounded. So sit up nice and tall. Brace those abdominals as if somebody's going to punch you in the gut. Keep a little bit of tension in it so you don't have to bear down like you're going to the bathroom or anything, but keep some tension onto that gut. And from there, he's going to shift his weight forward onto that front leg, and you start to feel a little bit of a stretch in the front of that hip. This primarily targets the iliopsoas. I have on video or on a tablet here. Let me pull this up so you guys get a good look at what that psoas looks like in anatomy. So if I isolate that structure for you, that's the psoas major. It actually has a spinal component. It originates from the transverse processes of the lower part of the thoracic and the lumbar spine, and then inserts into the front of the femur. And you can see it is a very powerful hip flexor. So again, he's going into this position of a little bit of hip extension to target this muscle to stretch it. Because when you guys are cycling and sitting, that muscle is slack and in the flex position. Okay? So give you a little visual. I hope you all can see that. To progress that a little bit and to focus a little bit more, bring the quadriceps into it, I can have Caleb here elevate his foot onto a bench. If you are doing it in your living room, put it onto the back of the couch, put that knee down onto the part where you sit on the couch, and now you take up more tension in the quadriceps, specifically the rectus femoris, which originates from the pelvis and then runs all the way to the other side of the knee. Same points of performance here. You want to keep a nice solid torso, trunk, hip position, brace his abdominals, and then he can lean forward slightly, shift his hips forward to get a better stretch. Now, one thing that I didn't mention on that last one that is important to do with both exercises is turn this glute on, that butt muscle, that butt cheek right here. Go ahead and squeeze that butt. That doesn't mean squeeze it with your hands. Actually tighten that muscle on your own and shift forward. And you'll feel yourself target stretching the front of that hip a little bit more. Stretching the hip flexors is a great way to start, but turning on those glutes are a great way to finish. So what I like you to see here here next with Caleb is, as he's lying down on his back, we're going to show you 2 series of bridges, a little bit of a progression. The first one with double legs, just bending both knees. From here, he's going to start off with bracing his abdominals, as if someone's going to hit him in the gut, keep some tension in the abdominal region, and then drive through his heels, lifting his hips up off the ground. So that's a perfect bridge right there. He's really turning on the glutes. He's going into hip extension. What we don't like to see is, go ahead back down, Caleb, and show him the arching of your back. So a lot of people really want to get as much range of motion as they can, and it's coming from their low back. Again, you see the difference here. He's starting to arch and really hyperextend at that low back versus the first way where he braces the abdominal and it comes from the hips more. So that's a double leg bridge. If that seems pretty easy to you, or you master that skill, you can make it a little bit more challenging and go into a single leg bridge. So in this one, now you notice how he really hiked that foot up into his butt region on that left side, really pulling it in. That makes it a little bit more of a glute dominant, so the glute max dominant versus hamstring. So make sure you really pull that knee in and give your opposite leg a hug. And now you perform the same exercise. Push through that heel, lift those hips. Not only are you doing single leg, making the one side more challenging, but because of this hip being in this end range flex position, it's forcing the pelvis to stabilize on its own a little bit. It won't allow you to compensate for mobility restrictions with a tilted pelvis in the other direction. So the stretches, good to hold them for 3 sets, 30 seconds, a couple times a day. And then the bridges, it doesn't hurt to do 2 to 3 sets of 10 at a time on each leg, or if you're doing the double, 2 to 3 sets of 10. So give it a shot. Let me know, if you have any questions or you want some feedback. You can give me a call, 412-499-4524, or you could send me an email. It's jholzworthdpt, doctor physicaltherapy @gmail.com. All right, thanks, guys.